very much. Now, we've talked about the very new, and I'm going to talk about the very old medicinal cannabis. And this is a big deal because there's a lot of hype around this whole thing, okay? And to start this, we need a story that begins a long time ago. And let's see if this works. Oh, it does, yeah. And here's my single kind of video prop here. We're going to, go back in time. Oh, let's see what happens. Oh, I think I'm going to have to press this. Let's see. See if my prop works. Oh, no. Oh, here we go. There it is. Whoa. We've got to go back in time, almost 12,000 years ago, because I'm going to set the scene about medicinal cannabis by talking about hops. There's a link, as you'll hear, and aqua vita, the water of life, which happens to be alcohol. Now, as it turns out, for at least 12,000 years, we've had fermented beverages being brewed and distilled, and this has been widely used for generations as a wonder drug for medicinal properties. However, we all know that alcohol has a dark side as well, and it can do some bad things to us, serious harm. So, thinking about alcohol, aqua vita, the water of life, as a wonder drug, it's been widely used for almost everything. And in the 17th century, when the plague was rife, it was recommended that a bit of rue sage and 2 pints of wine per day was a great cure against getting the plague. For crying out loud. Meanwhile, up to 1941, a remedy for little babies with colic and teething babies with Atkinson's infant preservative, which didn't have any opioids, no narcotics in it, but was 50% alcohol, and no doubt incredibly effective, having a baby settle down. So that's aqua vita. What about hops? Now, Hildegard of Bingen, who is a Benedictine nun, a wonderful composer and scientist, actually used hops to make beer, and used it for anxiety and restlessness. And in the Middle East, Abdullah ibn al-Baitar used hops as a cure for epilepsy. And so hops and alcohol have had a place as wonder drugs. Now, why am I talking about hops? Because hops is a part of the Cannabaceae family. It's a close relative to cannabis, okay? Yeah. Now, cannabis, as you know, has been indigenous to Central Asia and China for time immemorial, often divided into 3 species, sativa, indica, and ruderalis, although many would consider these as subspecies, and there's endless strains with colourful names like Tangerine Dream and, Alien Dog that have proposed amazing benefits. Now, cannabis is a big deal and has been a big deal for millennia. It's perhaps the oldest plant that's been cultivated for human use and has been grown at least for 14,000 years for fibre and rope, and, like alcohol and like hops, has been not only important in religion and culture, but used for its medicinal properties. Now, a little bit of a segue to non-medicinal. Its seeds are actually quite high protein, and from 6,000 years ago, it was one of the original 5 Chinese cereal grains. And in terms of fibre and rope, it's incredibly powerful. And in fact, the first medical journals were published on hemp paper. And canvas. We've explored the world thanks to hemp. In fact, canvas is from the French canevas, made of hemp. And sure enough, hemp made canvas. Now we make it out of cotton or linen, but we sailed the world with rope and discovered the world because of hemp. Now, what about its medicinal uses? Well, Mesopotamia, that's where the Tigris and Euphrates rivers are in the Middle East, now modern-day Iraq and Iran. It's been used as a medicinal preparation for at least 2,000 years. For virtually everything, a little bit like alcohol, erectile dysfunction, lung congestion, grief, anxiety, and depression. And in numerous of the tablets discovered in Mesopotamia, the epilepsy is referred to as the hand of ghost. And the hand of ghost was treated with Cannabis, sure enough, mixed in beer. Back to hops and alcohol and cannabis combined. Why not? Polytherapy. India, of course, has also had an ancient and long relationship with cannabis for religious and medicinal reasons. And in the Vedic texts, it's been promoted as a treatment not only for epilepsy, but for insanity, stuttering, to freshen the intellect. So that's something I'd like to do myself, but there you go. Now, what about Europe? Now, in Europe, the use of cannabis was spread by the Scythians. They came from the southeast of Russia and Ukraine through the Altai Mountains and into Germany and west to Europe. And these were fearsome nomadic warriors who loved their horses. And the reason I mention that is because this is a display of the Scythians at the British Museum a few years ago, the warriors of ancient Siberia, that has a remarkable similarity to the Dothraki in the Game of Thrones. And sure enough, Martin based his Dothraki on the Scythians. Now, it got to Europe, but was it a big hit? Well, the short answer is no. In the 16th century, Pietro Mattioli, who was a renowned physician and botanist, referring to using hemp seed to treat epilepsy, described, "I never consider those silly women," I don't know why it's just silly women, "who give decoctions of cannabis seed to children who are epileptic because of the harm added." So he wasn't that impressed. Okay. However, back to India. William O'Shaughnessy was sent to India. He's an Irish physician. He went to India as a part of the East India Company, and he was an amazing man. Invented the telegraph. He was an engineer. He was a physician and a chemist. And he was open-minded, and the Ayurvedic practitioners in Calcutta were using cannabis for the treatment of epilepsy. He took this seriously, experimented initially on animals with epilepsy and then patients, and found it was useful. And his first published description in 1841 was of the successful treatment of infantile spasms, that dreadful condition. And O'Shaughnessy treated a 40-day-old infant with heroic doses of cannabis tincture, and it really saved this little one's life. And so he published this in 1841, and his conclusion, and this is from his publication, constitutes the grounds of my belief that in hemp, the profession has gained an anticonvulsive remedy of the greatest value. Now, he published his research. He headed back to England with a truckload of cannabis specimens that he gave to the Kew Gardens, and they're still there. And from then, 1841 to the 1930s, cannabis became mainstream treatment in a big, big way. Sir Russell Reynolds, who was the personal physician to Queen Victoria, promoted the cannabis after reading about O'Shaughnessy's research. And so then, for almost 100 years, cannabis was available from pharmacies for virtually everything. A little bit like alcohol and hops, the next new wonder drug. However, Sir John Reynolds, who was a great fan, after 50 years of experience with it, recommended it mainly for senile insomnia, something that perhaps I need. But with respect to seizure disorders, he'd become a little bit lukewarm, okay? Sometimes, and mainly children. That was his feeling about cannabis. And around about that same time, bromide appeared, the first serious anti-epileptic drug other than cannabis. Now, this was a wonder drug. It was producing at least 50% remission in newly diagnosed epilepsy patients, and it was written with awe. This is a wonder drug. We're not entirely helpless, and none of us like to feel helpless. This is a very powerful thing. And how big was the hit of bromide? Well, by 1890, the National Hospital at Queen Square was prescribing 2,000 kilograms of bromide a year. It started to become a part of elixirs. Nervine, which was used in the US, you'll notice its ingredients contain cannabis, bromide, and hops. A holy trinity of amazing power. And Nervine was basically promoted as a treatment for everything, not only epilepsy, dyspepsia, hysteria, whatever. And here's one of the ads from the time, which I just loved. I thought I'd show you. Hello, Mary. What time? Say, what's that terrible noise? How can you stand it? The kids are going crazy in the background, of course. Oh, that's the children playing. Since I've been taking Nervine, nothing bothers me. So for goodness sake, what a cure. And by 1928, 1 in every 5 prescriptions in the US were for bromide, over the counter as well. And so what happened? Bromide fell from grace. Large doses were basically bombing people out, producing terrible skin and gut problems. And W.C. Graves, one of the epilepsy physicians in the US, described bromide as making patients stupefied, made to live a living death. And so the glamour came off, basically. But meanwhile, cannabis, until 1937, was freely available, including infant relief, cannabis hashish candy. It was incredibly available. But despite that availability, by the beginning of the 20th century, its use for everything, including epilepsy, was already in decline. Okay, that was because aspirin came along in 1899, which was a heck of a lot better for joint pain, and phenobarbital in 1912, which was an incredibly powerful and useful drug. And then another drug was promoted as a wonder drug. That was cocaine, the next wonder drug. Now, this was all happening before political prohibition. And I might add, since I've mentioned phenobarbital, which was synthesized in 1912, this is a powerful and very important anti-seizure medicine. And the idea that old-fashioned is old news is total rubbish. Phenobarbital is a very powerful and useful anti-seizure medicine and shouldn't be forgotten. And what about cocaine? Well, cocaine seemed to be the cure for everything. It was a cure for shyness in children. Throat drops, indispensable for singers, teachers, and orators. Carl, there you go. And it was promoted by Pope Leo XIII. Van Mariani, which was a wine, contained cocaine. And the Pope gave it his personal endorsement. Now, from then, as you know, the 1930s, thanks to some dreadful policies from the Federal Bureau of Narcotics in the US, it was made illegal. Harry Anslinger was on a personal campaign to make it, brand it like a narcotic, and it fell from grace, as you know. However, as I've already mentioned, it was already on the major decline, despite 100 years almost. And by the way, that legislative illegality was not supported by the medical fraternity, and the American Medical Association, William Goodwood had said, the American Medical Association knows of no evidence that marijuana is a dangerous drug. It loses sight of the fact that future investigation may show that there are substantial medical uses for cannabis. And so the medical fraternity wasn't against cannabis, we were trying to support it. But of course, politicians don't listen. There you go. Meanwhile, despite its illegality, Raphael Mechoulam in Israel made wonderful work identifying some of the molecules in cannabis, also indicating that cannabis itself contains over at least 400 different compounds, many of which we have no idea what they may or may not do. All needs to be investigated. And Mechoulam and his colleagues showed that both THC, the thing that cannabis allows people to feel high on and get the munchies, that's tetrahydrocannabinol, and CBD, cannabidiol, have anti-seizure effects in animal models. Now that wasn't a surprise because the Mesopotamians, the Vedic texts in India, and O'Shaughnessy, over 100 years before had said that. So no surprises there. Still, whilst it was illegal, there was of course, widespread recreational use of cannabis in the 60s and 70s and beyond. And anecdotally, when it was used, cannabis for epilepsy, it had a pretty checkered track record. Some dramatic improvements, some dramatic worsening of epilepsy in a big way. And then there were numerous surveys on patient perceptions of people with epilepsy who were also using recreational cannabis. And the bottom line was most people with epilepsy using recreational cannabis didn't find that it either helped or harmed. And in fact, making it a notch above alcohol that unequivocally, aggressively triggers seizures. And so, in fact, my default position was, if you want to avoid triggering seizures, avoid alcohol. Okay, that's not an endorsement for having an illegal drug, of course, but there you go. Now, what is the attraction of cannabis right now in 2022? Well, like so many other things, it's a hope, okay? We've tried this, we've tried that, we've tried this. I want to try something natural, that's been around forever. And so the promised benefits attract us, particularly with media hype. Secondly, the belief that because it's natural, in some way, it's working with the body as opposed to against the body. Now, that's a belief system, but obviously it's not quite right because tetrodotoxin, the blue-ringed octopus toxin, is 100 times more lethal than cyanide, but it is, of course, natural, just like strychnine is natural. So we don't want to be too worried about natural and unnatural. And then there's the attraction of the wisdom of the ancients, that somehow the evil modern medicine has left behind, the wisdom of the past, and that has an attraction and the sense that you're being empowered. And I understand that. So what about legalization? Well, that's happened. And this happened particularly because of press coverage of miraculous, and they really were miraculous responses to cannabis and cannabis products. And there's in the US, the Charlotte Figi, who had Dravet syndrome, a very rare and devastating epilepsy, responded beautifully to cannabis. And that produced pressure that ultimately has created barriers being crashed down with respect to medicinal cannabis. And so now we're into this revival mode, okay? And in terms of scientific evidence, in 2017, Charlotte Figi had Dravet syndrome. The use of cannabidiol in drug-resistant seizures and Dravet syndrome was published in the prestigious New England Journal of Medicine by many of our colleagues, including Ingrid Scheffer in Melbourne. So what did this study show? And Sam Berkovic, another friend and colleague from Melbourne, cannabinoids for epilepsy, real data at last, okay? So let's have a look at the data. 120 children were in this study. Half of them got cannabidiol, 20 milligram kilogram a day, half had placebo. And they looked at the median, that is the average drop of frequency of convulsions. This is tonic-clonic seizures. And they went from about median of 12 to about 6 per month. That's averaging out the children, 60 in each group. However, there were no difference in drop attacks or other seizures. There was no difference in the need for rescue medicines and hospitalizations. And 13% needed to withdraw from the drug because it aggravated seizures or had other side effects, including liver toxicity. And so a year later, in 2018, another study came out with cannabidiol in the Lancet this time, same dose of cannabidiol versus placebo, 86 versus 85 patients. And of this group, 16%, almost 1 in 5, had to stop because of side effects of the cannabidiol. Again, there was a median reduction in drop seizures from 44% for CBD to 22% for placebo. In other words, the sugar tablet had a 1 in 5 response rate. Okay. And then if you look at the actual from this study, and there was no difference for seizure freedom in both groups. And if you look at the study, and this is a graph of the perception of how good it all was, with the green columns being the placebo and the blue columns being cannabidiol. And this was the perception of the patients and their family and loved ones. And you can see no change, 32% of cannabidiol, 51%. Slight improvement, very similar. Much improvement, very similar. In fact, there was just the occasional patient, less than 1 in 10, who'd had a response, but it was by no means the majority. The majority, it was a dud, basically. But with this data at hand, the FDA the Food and Drug Administration in the US, legalised the use of cannabidiol for Dravet's. 1 in 50,000 people have Dravet syndrome, by the way, and Lennox-Gastaut, a much more common problem. And not that long after, as you know, the Australian government, with Greg Hunt as our health minister, said that yes, we're going to allow medicinal cannabis to be used in Australia, which was a great advance. And this then has spawned multiple companies who are producing locally medical grade cannabis and CBD. Now, this is very important, the whole issue of medical grade. Now, which brings me to contrast medical grade, which is incredibly expensive because it needs quality control, versus online CBD oil. There are various oils that you can buy through the internet, and buyer beware. For example, a study from the US looked at 84 non-approved CBD products from the internet. Only a third of them were labelled correctly, and many of them had little or no CBD, despite being flogged as oil. A similar study in Europe looked at 29 online products, and 2/3 of them exceeded recommended levels of carcinogens, that is, and including pesticides and heavy metals. So not a great kind of story there. And then in Utah, in 2018, 52 people were experiencing aggravation of seizures, hallucinations, and unconsciousness because of online CBD oil. And sure enough, they had synthetic other cannabinoid molecules in it. And just in our own experience, and this here in Perth, and you'll notice Genevieve in the audience, we published this where we've looked at many patients presenting with seizures having had recreational synthetic cannabis. In other words, cannabis has a glass ceiling. If it has a lot of THC in it, it's a seizure aggravator in a big way. Okay, so there you go. Now back to Australia. Now this is from May of this year. This is approvals through the special access scheme of our federal government for using cannabis-based products, whether it be CBD or THC. And you'll notice that epilepsy doesn't seem to be there because it's sort of, pretty small change. The main reason that doctors in Emerald clinics are prescribing cannabis is chronic pain and anxiety. Okay? Now, how good is cannabis for that? Well, I'm not sure. Well, let's find out. One thing for sure, there's no doubt that nausea and vomiting in cancer patients can be very prominently helped by cannabis products. Spasticity and multiple sclerosis can be helped by cannabis products. And we know from O'Shaughnessy way back in India, individuals with epilepsy can have a miraculous response in a small minority of patients. But for none of these are the cannabinoids really first-line therapy. And when it comes to chronic pain, a study from New South Wales looking at 1,500 patients found that those taking cannabis and cannabis products for non-cancer pain had greater pain and lower effectiveness in managing pain than those who weren't on it. So it's not, not a great good news story. And when it comes to anxiety, there's even less data. Some people are relaxed and other people get kind of paranoid and freaked out. So back to the legal product, and I'm talking about the medicinal medical grade cannabidiol, which is marketed in Australia as Epidiolex. Now in September 2020, it was approved by our Therapeutic Goods Administration for Lennox-Gastaut and Dravet syndrome, but approval doesn't mean that it's funded, okay? Fast forward to May 21, it was approved to Dravet syndrome only, but not Lennox-Gastaut syndrome, so only PBS funding for Dravet's. But September of this year, it's been approved for pharmaceutical benefits approval listing for Lennox-Gastaut syndrome. So many of my patients, we've talked about this, with Lennox-Gastaut syndrome, we may have now the opportunity to prescribe funded CBD. Now, why do we want funding? The reason is because it would cost a minimum of $30,000 a year without PBS funding to have somebody on CBD. Okay, which brings me back to a certain circularity of things. Epidiolex, each mil contains 79 milligram of alcohol. Okay, and so a single dose of CBD in an adult having Epidiolex is about 12 mil of wine per dose. And so it's used to solubilize the CBD. And so weirdly enough, the old Aquavita is still there. It's still beckoning us. Now, how good is CBD for the most scary seizures that we see in people with dreadful epilepsy, the terrible epileptic drop attack where facial and other injuries? Well, these are a combination of studies that I've shown you. Here's CBD versus placebo, the green. Okay, some help, certainly better than placebo. Look at lamotrigine, Lamictal, at least as good. Rufinamide and topiramate, similar effectiveness. The best of this bunch is clobazam. The epileptic drop attack, Frisium, clobazam, is a mile better than CBD. And another drug, which we'll talk about momentarily, felbomate, has a better track record as well. So when it comes to CBD and the drop seizures, those scary ones, it's not that great. It's better for the tonic-clonic seizures. And as I've mentioned, depending on the dose, without PBS support, you're looking at $20,000 to $52,000 a year, okay? But up to 60% of people have unacceptable drowsiness or behavioural problems, diarrhea and liver toxicity, and seizures may be worsened. So certainly I embrace CBD as an opportunity, but it's not, wow, another wonder drug that we've been ignoring and neglecting for so many years. Which brings me to felbomate. That had a good track record, a bit like clobazam. Well, felbomate was a great wonder drug in 1993. In fact, I've still got a few patients on it. It was a fantastic drug for the epileptic drop attack, but unfortunately, it rarely killed people by producing bone marrow and liver damage. Now, the likelihood of that is 1 in 10,000. And if somebody is falling and crashing to the ground and they have a mortality of about 0.5% a year, maybe that risk is sometimes justified, even something scary like that. But have we got a new wonder drug related to felbomate? Is cenobamate. This isn't approved by the TGA. When it becomes more readily available, it's a heck of a lot cheaper than CBD. And notably, just in the past month, in the Epilepsy Journal, there was an encouraging response in Dravet syndrome who'd failed CBD, and sure enough, cenobamate did a good job. And so, hey, are we running out of options? No, there are additional options to try, and we need to keep on trying. You know, never give up, never say die. Now, what about those old-fashioned dreadful drugs that some of you may be on, Dilantin and Tegretol? Well, I tell you what, these may be the only medicines that rescue people and keep them out of hospital. So some kind of rigid mission, or let's get rid of those dreadful old drugs and come up with something new, even cenobamate, may produce major and life-threatening worsening of seizures. So don't judge based on old or new. Now, what about prescribing and deprescribing? Now, this is something that you all know already. I've got to listen to you. We've got to work as a team. We've got to work as partners. You know, medication changes can be a real pain in the bum, and you get sick of them and think, look, I'm tired of this. I just don't want to do it. And that's why the attraction of surgery, can we operate? Can we put a laser in the brain and fry something is attractive, but it mightn't be relevant to the vast majority of people with dreadful epilepsy, okay? And there are times when changing medicines is not acceptable for anyone, you know, a change in the group home arrangement, you know, parents are away, you name it. And so we have to work as a partner. The other thing is changes have to be gradual because and Mark is an expert in this area, there's this inherent fluctuation of seizures getting worse and seizures getting better, independent of urinary and dental and other issues, constipation, which is a part of the beast, this epilepsy. And so if I start a epilepsy medicine at the top of a peak and the person's starting to get better anyway, I might think I'm doing a good job and it's got nothing to do with it. So you've got to have a regular change. Now, finally, what about the other medicines? Temporal lobe epilepsy and cannabidiol. Well, it's a dud. I mean, there was a gel study in 2017, a cannabidiol gel versus placebo, no difference in temporal lobe epilepsy, focal epilepsy. And another trial just recently come out, cannabidivarin, another synthetic cannabinoid, looking at temporal lobe epilepsy, no difference between placebo. So for the standard focal epilepsy, it's a dud. So what about CBD? It's not a first-line treatment for any kind of epilepsy. It's not some ancient wonder drug. And the reason it fell out of favour over 100 years ago wasn't because it became illegal, because it just wasn't that good. So it's not an effective alternative to most conventional treatment. It does have a lot of side effects, including liver toxicity, but it is an opportunity that in the right situation, we're going to embrace it. I don't mind if it's got, if as a partnership we wanted to give it a go, we'll give it a go. Unfortunately, medical cannabis has been cleverly marketed and captured the imagination of the population as this sort of ancient wonder drug, and sadly that's not the case. And in fact, as an aside, in this month, 2 companies have been fined $240,000 in total for inappropriately flogging cancer and epilepsy claims on their websites. And so there's a money market thing happening here too that you've got to be aware of. And the challenges that we're facing are that government is facilitating the use of medicinal cannabis, which is great news. I'm really embracing that. But this legalisation's moved faster than actual data and research. And media creates this hype which brings hope in an unfair way. And if you're not embracing it, you're seen as an enemy of the people, trying to provide a balanced situation. And back to that chart, remember the clobazam? It's not on the PBS. Why on earth? Why don't we have a campaign to make it on the PBS? So, what have we learnt from history? We need to be open-minded. 30% of conventional medicines come from plants. So do we need more cannabis research? You bet we do. Cannabis does have anti-seizure properties. We've known that for millennia. Infrequently, it can be a wonder drug, and we're going to embrace it with both arms. But in most patients, it's not the winner that you'd hope it would be. It's less effective and has more side effects. And just like Pope Leo XIII and cocaine, embracing some new wonder drug without really thinking about the facts is a bit scary. And this is my final slide. As Marie Antoinette said, there's nothing new except what's been forgotten. And people have forgotten that in that 100 years that cannabis was over the counter, including candy, it was replaced by bromide and then replaced by phenobarb because they were much better drugs. So that's it in a nutshell, guys. And then I'd love to be with you and have lunch and catch up with old friends and new friends here. But unfortunately, I'm going to, about 5 minutes now, got to run away because I've got another responsibility that I've got to face. So thank you.
Who's got a question for Professor Dunne? Couple of quick questions before the professor has to